First, thank you so much for spending a few moments to watch this video podcast. My name is John Rees. I'm a doctor of chiropractic, and I have been a doctor of chiropractic for the last 22 years. Personally, I am based in Ilkley in West Yorkshire, but the aim of this video is really to introduce you to chiropractic. Many of you may have heard of chiropractic, and some of you may have exposed yourself to it and had treatment from a chiropractor. If you're in the latter category, then you will probably know most of this, and it may not be beneficial for you to listen further. If you're in the former category, then one hopes this will be of benefit to you. It is quite strange, I think, that when one realizes that chiropractic is the third biggest medical profession in the world, that is after GPs and dentists, then the third biggest profession is chiropractic. The reason why, if you're based in the UK, you may not, you find that comment strange, is because chiropractic predominantly comes from the States, and this has only been in recent times, in the last 40 years or so, that chiropractic has become much better known in the UK. But simply put, chiropractic is a manual therapy. Obviously it means we use our hands to treat patients, and the methodology by which we treat patients is what we would call soft tissue work, which you would call probably massage. What we then call mobilization, which is basically, for want of a better, more medical term, wiggling the joint about so it can relax the musculature. But then the final thing that we most often do is manipulation, which means increases the range of motion of the joint such that you get more obvious movement to that joint and associated joints, and also that the muscles can relax that work those joints. When we do those three things, soft tissue work, mobilization and manipulation, we obviously have a particular effect on the musculoskeletal system, but we also have a direct and indirect effect on your neurological system, which is very important. Most people who come across chiropractors believe that we treat backs, and predominantly low backs and people with low back pain. Now, ironically, because most people think that's all we treat, most people who present to us present with low back pain, and hence, therefore, most treatments that we undertake are for people with low back pain. But chiropractors treat any musculoskeletal complaint. Now, that may be your thumb, your neck, your shoulder, your elbow, your ankle, your thoracic spine, your knee. So anything that has a muscle or a joint associated to it, we treat. Many of you will have heard that chiropractic is categorized within the term alternative therapy or complementary therapy. And there are a broad spectrum of therapies which are put in that basket. And the implication is that it's not mainstream, and the implication is that mainstream means the use of drugs, the prescription of drugs, and going to see your GP. If we just introduce you to a little bit of the history of medicine as it relates to and associated with chiropractic. Chiropractic, for want of a better term, was born in the 1880s, and therefore we have been around practicing chiropractic medicine for over 140 years. What we now has been deemed to be mainstream medicine, i.e. the use of drugs to assist one's symptomology, really has only become active since the 1920s, and particularly since the Rockefellers got involved in the manufacture of drugs. So in a sense, medicine as is deemed mainstream is probably 100 years old, whereas chiropractic is 140 years old, and prior to mainstream medicine and drug manufacture, the term naturopathy was often used. So chiropractic really is mainstream, and the reason it has been categorized as complementary or an alternative could be debated, and if one was being skeptical, one would sort of say that perhaps it is the drug companies who've tried to sideline the importance of chiropractic to their own benefit. And the reason one could say that is that 20% of the turnover of most big pharmacological or pharmaceutical companies is for medication utilized for low back pain alone. So 20% of your turnover that might be affected detrimentally by going to see someone who is well known for successfully treating low back symptoms and who does not advocate the requirement for the use of medication necessarily or particularly to assist in the beneficial outcome of such symptomology is not necessarily going to be strongly supported by large pharmaceutical companies. But there we have it. Most of you will be aware that there are 3 musculoskeletal professions: physiotherapy, osteopathy and chiropractic. And many of you may therefore perceive that depending on what condition you are suffering with, you will see either an osteopath or a chiropractor or a physiotherapist. The fact is that all 3 professions treat the same conditions. The methodology by which we do them is slightly different, but ostensibly the aim, of course, is to get the same result. This video is not intended to create a wedge between chiropractic, osteopathy or physiotherapy, because all 3 professions have relevance to treating patients. The main difference that one would see in a training point of view is chiropractors generally train for 5 years to become doctors of chiropractic. Osteopaths train generally for 4 years, and physiotherapists generally train for 3 years. That therefore means there is a difference in certain amounts of knowledge and perhaps techniques between the 3 professions. But I would strongly advocate that one of the most important things as a patient in dealing with a musculoskeletal specialist is the relationship that you build with that clinician. Oftentimes it is the relationship and the trust that is born out between the clinician and the patient that provides the most satisfactory outcomes for the patient. Once you've made the decision to visit a chiropractor, your initial appointment will normally last up to an hour. Now, the reason we offer patients and give patients that length of time is such that we can both get to know the patient somewhat personally, but also to get a detailed history of the condition with which they're presented to us. Because if we can understand right at the outset the nature, the severity and the onset and the causation of the patient's problems, clearly we will be able to diagnose it better, and therefore we will be able to treat it better and more efficiently, and therefore ultimately the time taken to get a resolution from the patient's perspective is less. So at the initial consultation, we take a full patient history, then it is followed by a pertinent examination of the patient of the relevant areas, which will include orthopedic tests, chiropractic tests, sometimes neurological tests. Then subsequent to that, we'll give the patient a report of findings so we can tell them exactly what we found as is pertinent to their presentation. And then we'll outline the manner by which we're going to treat the patient, and at the last part, which is usually about a quarter of an hour of that initial hour's consultation, will undertake the first treatment. So once you've left the chiropractic, you will have had a good idea of what your condition is, and also he or she will have undertaken the initial treatment. Thank you again for taking the time to work your way through the whole of this podcast. I hope that has given you some information and some substance as to the benefit of seeing a manual therapist, a musculoskeletal therapist, and hopefully a chiropractor. As I say, my name is John Rees. I'm a doctor of chiropractic. I am based in Ilkley, but you can find chiropractors throughout the UK and in any country that you may be viewing this podcast on. If you're looking for specific details of our clinic, you can find them both up here, and also I think you might even find them here. So please feel free to contact us either by email, via our website, or directly by phone in order to make an appointment if you so wish, or even to get some clarification as to the things that you perceive chiropractors may assist you with. And once again, thank you so much for spending the time to watch this video, and we will be communicating again soon, I hope. Thank you.